Educating patients, family, and hospital staff on the many risks of heart attacks and cardiovascular disease at St. Jude Medical Center in Fullerton is the responsibility of registered nurse Armida Fournell. We talked with her about cardiac risk and also preventative measures that should be followed.
I do community education classes on prevention, but I take care of all the patients who have heart surgery, patients who have myocardial infarction. So I go over their disease entity so that they are prepared for their surgical procedure and are able to control their risk factors after surgery so we don't have them back again. Right now, the thrust is particularly women in heart disease. We need to prevent that disease because that is just becoming epidemic in the United States. We all need to know our risk factors. Women's symptoms are different than men's. Usually, classically, you see someone grabbing their chest and pain going down their arm. Women tend to have symptoms like gastrointestinal upsets. They tend to have palpitations. They tend to have fatigue. They tend to have nervousness and anxiety that they can't really put their finger on. They tend to have some more shortness of breath, discomfort or pain in the back of the shoulder blades. So when their symptoms are brought forth, the physician has a difficult time diagnosing their problems. And then if they're diagnosed appropriately, they are not treated historically the way they should, not as aggressively as men. Women need stress echocardiograms. The stress treadmill that men have is just not as sensitive as women. So it's a problem of symptoms, of having the right diagnostic test, and then women need to be really proactive and insist that they get the right kind of treatment. Women are not getting diagnostic tests as quickly as men, like exercise tests. And once those tests are done, then comes the angiogram. And the angiogram is really the gold standard for diagnosing heart disease. And historically, women have not gotten those tests because that leads to the appropriate treatment, which would be angioplasty, which is the balloon that squishes the fat against the wall of the artery, or the stent, which is like a little scaffolding that holds the artery open, or coronary artery bypass, which is the treatment, the surgical treatment for heart disease. Aspirin is one of the first treatments that a woman should do, or a man should do, when they have a symptom of a heart attack. It's a chewable aspirin, not an enteric-coated or not a coated aspirin. It should be taken immediately. Women are not knowledgeable that they do indeed have the risk of having a heart attack. It's not if they're going to have a heart attack, it's when. Right now, the American Heart Association has a campaign. It's a national campaign to bring awareness to not only to the public, but to physicians that heart disease is prevalent in women. 800,000 women live with heart disease. 366,000 die every year of heart disease, much more than all cancers put together, including breast cancer, which is woman's most fear, I believe.